Live on WFLA Now. This is Run for Fun with running enthusiast Leigh Spann.
Yeah, I remember that one.
All right.
And then the lady was like,
hold on, here we go. Welcome back to the Stream Center for this week's episode of Run for Fun. Now, we hope this show continues to help you enjoy running by making it a part of your lifestyle rather than a chore, something you feel like you have to do, or worse yet, a thing that you have dread to do. So I'm your host, Leigh Spann. I'm the morning meteorologist at the WFLA news station in Tampa, Florida. But I've also been running consistently now for about 14 years, and sometimes that is hard for me to believe. I would have never thought when I signed up for that first half marathon all those years ago that I would still be out there running, smiling, and I'll tell you, it hasn't always been easy, but it has definitely been worth it. I was very lucky at some point early on, several years into running, not realizing I was doing everything wrong, to meet a group of people who told me a lot of the things that now we try to share on this Run for Fun podcast. And of course, the leader of that group, Coach Maria. Good morning, Coach.
Good morning, Leigh. How are you today? I heard you had an awesome run this morning.
I did. I will say I was listening to you in my head because you always say if you tell your mind it's going to be really bad, then it's never as bad as what you said. And so like, oh, it's so hot. Oh, this is like, this is going to be tough paces to hit. And then I was like, oh, well, nearly as bad as I expected it to be.
It's always worse in your head than it really is in real life. I promise you.
And how have you been?
I'm good. We're in Virginia at the lake right now. My son has officer training school next week, so we're enjoying some family time before he heads off for 6 weeks.
Well, thanks for joining us to spending an hour with us while the rest of your family is off.
Wouldn't want to miss it.
Yeah. And so we still have our Run for Fun Strava group, as we know, and every week we get a little bit more activity. So currently we have 296 members on our Run for Fun Strava group. Please download the free Strava app and then join the groups and the clubs because a lot of times, people have been asking questions. Maria's able to answer, but you can also just kind of get feedback from other people asking where they run, things like that. So we're using this more as a social media, but it also tracks all of your runs, right, Coach?
Yeah. Speaking of, how have you been doing with your Juicy June Challenge, Leigh?
Pretty good. So if you break it down, so our Juicy June Challenge is 200 miles in the month of June, and it can be walking, running, biking, swimming, any sort of movement going forward, as long as it can be tracked on Strava. And so I've definitely been biking more, especially in the hotter parts of the day. And I'm at about 120, 125. So if theoretically, I should be at about 150 because we have one more week left. So if you do 50 miles a week. So, I may get close, and that's much more activity than I would have normally done in June. So if that's the challenge is to get us out there, then I'll say that I have accomplished this.
And I myself am way behind on the challenge, but I will tell you why. It's because my coach has me limited to exercise and steps. So I'm only allowed to hit a certain number of runs and a certain amount of walks. So I am doing what my coach tells me to do. So y'all should do that too. Never go against your coach for a challenge. But I have enjoyed watching everybody do this challenge. I mean, I think it's great for those that need to be out there or to struggle getting out in the heat. So you guys are doing great.
And I do think that it may have helped me acclimate a little faster when I got out on the bicycle more than just, once a day on the runs. This was giving me 2 times out there, especially in the hotter parts of the day without ruining my body by trying to exercise twice, to do a hard workout twice a day.
Yeah. And you're working different muscles too. Yeah. So that's good.
All right. So you can see at the bottom there what our topic is for today. It's running in pregnancy and then how to adapt, especially for people who love to run, on a regular basis. Now they're have this pregnancy, and I know, Maria, you've dealt with many clients and through this process. But we're actually going to bring in Liliya Passman. She's a certified nurse midwife, but she's also a nurse practitioner. She works at USF OB/GYN and Tampa General Hospital. So thank you, Lilia, for joining us.
Hi. Thank you for having me. This is so fun. This is a topic that's very near and dear to me. I've always been really a big proponent of running. and through pregnancies as well, my own. But also this is a topic that comes up very often in my office and in my workplace. So it's fun to be here.
Well, let's start with that. So, when a woman comes in who she's seeing you because she's pregnant, but then she says, "Hey, I also have this running routine or exercise routine." What is some of the first things you talk to them about?
Yeah, so that's really the first question. Oh my gosh, I'm so used to any kind of aerobic exercise, really, or any kind of exercise, but running. They're like, I'm so used to running. Do I need to stop now? Oh my God, I'm in my first trimester. It's probably bad for the baby. And so the first answer, my initial response is usually, how are you feeling when you're doing that? Like, how does this exercise make you feel right now? And if they're like, I'm fine, I love it, it really helps me, mentally and I feel good after. And I'm like, well, keep doing it. The general answer is you should keep doing whatever exercise, running, any kind of aerobic activity is wonderful for pregnancy, lots of benefits.
And is there a limit to what you should do? I mean, obviously, should you back off, things like that?
And so then, great. Yeah. So the next question is like, well, can I just keep doing exactly what I'm doing? And in pregnancy, a lot of physiological changes occur. So your blood volume increases significantly when you get pregnant, especially in the second trimester. So first trimester, there's things like nausea that can deter you from running, but in the first trimester, you may not feel as much of the difficulty with breathing and what comes with increased blood volume in your body as you do in the second trimester, when things really start, you start feeling a lot shorter breath sooner. And so then I always say, just listen to your body. If you're ever feeling like you're having trouble catching your breath, you can't easily talk through the activity as you used to be able to do, hold back, kick back a little bit, slow down, less time, especially with the summertime, the heat and the humidity, that adds another level of strain on your heart and your lungs. And so when you're doing those exercises, you'll start feeling it even more.
Is there a certain thing that you're supposed to do for hydration when it's that hot? Like, do you have to pay more attention to that? Or like, is there a specific protocol for that, Lilia?
Yeah, that's great. So that's the other thing I always make sure to tell, excuse me, all the patients is that hydration in pregnancy, generally at least hitting like 100 fluid ounces a day should be your goal. If you're there, and then on top of that, you're also doing these other more kind of more vigorous activities, even higher than that. So at least another 20 to 40 ounces, especially in this heat, definitely staying even more hydrated.
And we talk a lot
to support that increase.
Yeah, we talk.
To support that increase in volume. Mm-hmm.
Yeah, we talk a lot about adding sodium. Taking salt tabs or adding it with the electrolyte drinks. Do you have to worry about the extra sodium impacting the baby?
Great question. So not necessarily, not specifically. So in general, in pregnancy, you are to be taking a daily prenatal vitamin every day. So that has some of those daily requirements for your minerals and so that, along with just a normal low sodium diet and hydration, it should be sufficient for the kinds of activities you're doing. Like I said, you're not doing anything that's going to cause you to be out of breath. So you shouldn't be, heart rate shouldn't really be going above like 140 in pregnancy. That's the other kind of thing I tell them. So if you're doing that kind of activity, you're not feeling out of breath, you're not feeling, winded, then it should be generally safe to continue doing the adequate hydration and support with just healthy diet.
Yeah. I did both my pregnancies different, and it was so funny because my first one, I honestly, your body changes so much, and my breasts got so huge and heavy and uncomfortable. And it just became uncomfortable to run because of that. And then I was having to go to the bathroom all the time. So I actually switched to elliptical. It's a challenge for me to keep my heart rate that low anyway. So just genetically, I have a high heart rate. So I did elliptical, and then that was with Sam. And then with Abby, I did nothing because I was chasing around Sam. And I myself felt much more tired my second pregnancy, and I felt much more achy without the exercise. Like my back hurt more. I didn't sleep as well. And so I I kind of did like a little experiment myself and realized, wow, just moving a little bit, because it's not like I was doing a ton on the elliptical, but I was doing 45 minutes all the way up till the day before I had Sam. And boy, I felt better.
Huge. You're absolutely right. That is such a typical response on the body when you're incorporating the exercise versus not. Not only is this just, facts, these are evidence-based kind of findings, but also, as you saw with yourself, I agree. I was same with all three of my pregnancies, was so different. First pregnancy I ran up until probably third trimester and felt fine. The body also, with each pregnancy, the more pregnancies you have, adapts differently. First pregnancy, you don't have another little kid running around that you're chasing after. You're not quite as tired. You can rest when you want to on a day-to-day. And you can kind of continue to incorporate some of those things that you were doing pre-pregnancy a little easier. Second pregnancy, yes, you've got a toddler usually, or another child running around or around to be focused on both mentally and physically, and that definitely takes away from your ability to incorporate exercise when you want to. And then your body, a lot of those just physiologically in pregnancy, your body's been what I call stretched out once before. It's been tested once before. So everything kind of needs more support, more achy, more uncomfortable. This is more common to experience that in third and onward pregnancies as well. So the other thing I'll say is interesting. You found that your body was more achy with the second pregnancy and with not exercising. You're right. Exercise. So continuing even a little bit of some form of activity in subsequent pregnancies can really help support less discomfort, better for your pelvic health. So urinary incontinence and things like that are really well supported by continuing to exercise. It's a hard battle. It's a hard balance to have. You want to really try to maintain at least 20 to 30 minutes. If you were doing it before, it's really, really helpful to continue to do it. Yeah, I definitely saw the same. Second pregnancy of mine, I ran probably till about mid-second trimester, and by the third I was like, oh my gosh, I'm so tired, I can't even function. And I would try to squeeze in every so often. It was nowhere near as regular. And with the peeing you mentioned, constantly having to use bathroom, that pressure on your bladder with each pregnancy, the more pregnancies you have too, even the first, but really the more pregnancies you have, you do start experiencing more strain on the bladder. And you go out for a 20-minute run, you stop at 5 minutes and 10 minutes. It's like, God, is this really worth it? And so, elliptical is a great other option.
That's the thing I see from a coach perspective. It's all about expectations, right? And it doesn't matter where you are in your training cycle or what season of life. It's all about expectations. And if the expectation is, oh, I have to stop more, that's okay. Like if you have to go slower, that's okay. If you have to walk, that's okay. It's more just the duration and time that you're out there and getting some blood flow going. And for the most part, as long as you're not being reckless, the mom is going to suffer more than the baby does, just the way that we're built. So hopefully if you can listen to your body will tell you when enough is enough.
Yes, definitely. That's the key. You should never, I always tell patients, don't ever make this exercise, running, whatever it is, any aerobic activity. Keep doing it because it's only going to benefit your heart long term. It's going to prevent heart disease. It's going to prevent high blood pressure later on. All of these things are super helpful. Never feel like a failure. You're not doing anything to try to challenge your body in pregnancy. It's more of a maintenance. You're trying to maintain your health. So that way, long term, you'll continue to support your heart, your whole body, your system, and you're going to keep running and exercising after baby. This is going to help with your mental health. It helps with postpartum, to fight against postpartum depression, not only physically, but definitely mentally as well.
It also helps with labor because labor takes a long time sometimes. And the more endurance you have for that labor, the less daunting that can be.
Absolutely.
I've seen some pretty incredible women do some pretty incredible things. I've seen women do half marathons and marathons pregnant. I've also seen a lot recently about weightlifting in pregnancy. How do you feel about weightlifting, and is it similar to the standards for running? Can you tell us a little bit?
Yes. So same gist is what I say. So same concept, same answer from a safety, benefits, risks kind of standpoint. So If you're doing it before pregnancy and you're comfortable with continuing, meaning your body feels good, you're not out of breath, you're not feeling severe pains and aches, during the activity, whatever it is, please keep doing it. There's not, you may find that you need to decrease your weights a little bit, decrease your reps. Otherwise your heart rate is sky high because of the physiological changes that your body's going through. And that's okay. Again, don't challenge your body. Just keep doing whatever it is, because any bit of, any bit of push that you're giving your heart and you feel good, it's only going to benefit you. It's going to be great. The things I say avoid are things that you're going to, anything that you're going to do activity wise, it's going to impact your belly, actually, cause trauma. So any contact sports, try to avoid those. Please avoid those. Ice hockey, boxing, even basketball, soccer, anything that's going to cause a direct blow to your belly. Scuba diving is not a good idea because you're depleting your oxygen intake. Skydiving is probably a dangerous one.
I don't suggest that ever.
Do women still want to play hockey?
Skydiving.
Do women still want to go out and play hockey? Have people really ask you that?
I don't have many that have wanted to do, I've had some that are like, oh, I started ice skating, or, I'm like, don't do anything that you're already off balance. Like, just let's try things like on the ground. Let's do things that are a little bit more controlled. And then the other one I do get asked is yoga. So yoga in general is awesome. I am a huge supporter. Yoga is actually, I'd say, it's so good for flexibility, labor. The breathing that you do through yoga is really wonderful too. And it's great when you run to do yoga as kind of a side, as Maria will tell you, stretching. But hot yoga is not, or hot Pilates. Some have asked me, please just refrain from anything that you're going to end up sweating excessively more than you would. You just be safe in terms of, again, hydration, nutrition, and you most of the time will be fine doing whatever exercise you're happy with.
So you mentioned that your heart rate is already somewhat elevated just because of the physiological changes. So can you go tell people how they should be tracking their heart rate when they're exercising, and even when they're not exercising with these changes?
Yes. So heart rate in general, I mean, there are lots of good trackers now that you can have, the watches, there's the ring. What's the ring that everyone's wearing now?
Ring.
It's the Oura ring.
Yes, the Oura ring. Everyone's like swearing by that thing. So any of those are probably great to have if you're like a numbers person, if you're a data person and you like to just, see, oh, okay, I'm at this and this. But sometimes that can kind of also cause you to be a little bit more obsessive than you need to be. The general guide is just kind of, can you talk through whatever it is that you're doing? So, like, are you completely like hyperventilating? If you're doing that, just stop, kick back, just worry about really maintaining good talking ability during the activity. And most of the time the heart rate follows.
And think about how much zone 2 you can get while you're running in pregnancy. When you're slowing down and not doing all the hard stuff, you can really slow down and get a good base training if you want to, even if it's less. It's so helpful when you come back.
So Maria, I have a question about what some of your clients might wonder, because a lot of us do run. It's a social thing for us. So now, now you're being asked to go slower, to stop and go to the bathroom, to walk more. How do you coach your clients to say, like, okay, you might not be able to run with your friends through this entire 9 months?
I mean, it's kind of similar to how I tell people that they can't run with some of the friends that they would like to run with because it's going to be detrimental to their training. I would say try to find somebody that's a little bit slower than you and run with some people that you don't normally run with. It's a good opportunity to meet new people. Maybe try to ask around and see if anybody else is pregnant that's running. And because there's just so many things in pregnancy that are happening to your body, especially the first time that you don't know about. It's always nice to have a friend that's going through it at the same time. So I would typically ask around, and really, I try to keep my clients running like less than 30 minutes at a time when they're training while they're pregnant, just for a safety standpoint. And we just don't need to do more then. It's more to keep you where you are and make it easier to get back into training after you give birth.
Yeah, that's what Lilia was saying.
Yes, I was going to add that. I was going to add that too, that there's so many currently, I feel like there's so many mom groups, through Facebook you can find locally, oftentimes, that finding someone else who's going through the same changes and who also has to do the same, just like Maria said, finding other pregnant individuals. And it also will help you to find more topics to discuss while you're running or exercising, because you'll be going through the same thing.
Yes.
Yeah, and it also helps afterwards when you have mom friends. It helps with postpartum depression. It's kind of like we talk about running all the time from a standpoint of it's just not running. It's so many aspects of your life. And if you have a built-in friend before you go through this, that can help you with postpartum and all that stuff. So don't be afraid to ask for help, ask other people, join some groups, even my little introverts, try.
Just try. So Lilia, at what point do you advise your patients to, okay, maybe it's time to just rest?
Yeah, so there's definitely times that, or I should say, patients who are pregnant who should just not keep doing what they've been doing. So the patients or the women who I was addressing, kind of keep doing it. Yes, that's awesome. Would be the low risk, like normal pregnancies, meaning you've got one baby. So usually twin pregnancies or pregnancies that have multiple babies, more than two or more babies. You want to definitely kick back more. You don't want to continue to do exactly what you've been doing. There's pregnancies that have, when you develop high blood pressure, when you develop what's called a placenta previa, if you have the placenta that's low lying in the uterus, anything that can cause bleeding in pregnancy, you'd want to avoid activities that we just discussed in pregnancy. Oftentimes, too, if you have like a history of chronic lung disease or heart disease, if you're like an everyday smoker, which oftentimes everyday smokers aren't running daily, but those kinds of conditions, you want to avoid these activities.
I have a question too, Lilia. I've had a lot of questions about females that are trying to get pregnant and struggling with getting pregnant. It seems to be a lot of women that are running a lot of miles. Have you, do you have any experience with, I've had some doctors tell their clients to not run as much. Is that anecdotal? Is that research-based? What can you tell me about trying to get pregnant and running?
Yeah, so this is a very kind of controversial topic amongst, I shouldn't say it's a hard answer. There's not a lot of evidence on women who are attempting to get pregnant, who are, everyday vigorous, strenuous activity people. So I've definitely had this conversation with high-risk physicians, maternal fetal medicine physicians, to try to really pull from them, like, what do I tell our patients? Because oftentimes, we'll send our patients to reproductive specialists and maternal fetal medicine specialists when they're not getting pregnant, in as timely as they want to be. So generally, if you're exercising like what we've talked about this whole cast, and like an everyday kind of moderate intensity, normal amount, less, 30 minutes or so a day, that shouldn't interfere with pregnancy. Some, just on a circumstantial basis, some physicians will, or I should say reproductive specialists will just say, like, do nothing, chill your whole body out, you shouldn't exercise at all. And some will really just say, keep doing what you're doing. So it's really, I think, circumstantial. Just, it depends on the provider, and it depends on that patient and how much activity, what kind of activity they're doing. Now, if you're a vigorously active, strenuous activity, more than what we've kind of baseline discussed here, I would say the recommendation by reproductive specialists would be to kick back.
Yeah. I mean,
I'm
talking like
visit
40 to 70 miles a week.
Yeah.
Probably.
That's like more extreme. Yeah, more
Yes.
extreme. I would say most would say to not do that many miles, to kick back, because when you're constantly in a more active state, in general, I'm just thinking physiologically in pregnancy, there's just more pump of the heart. The heart's pumping more, it's pumping blood to the more vital organs. The organs that are working to get pregnant are not really the vital organs, not the
Oh, that
heart,
makes
the
sense.
lungs, the kidneys. And so I'm just thinking from that perspective, and that's where that thought has come from, is you shouldn't be doing anything that, and that's not extreme for those people, but
Yeah, it's
for
not.
the people,
That's
for
where I've
the
had
people that are
trouble with the
doing it.
conversation. Yeah.
But just kind of from the physiological perspective of what's going on, it would be best. Why have another variable of why you're not getting pregnant is how I think of it. Why there's just so many variables. It takes so many things to go right for a pregnancy to push forward and be, and progress normally. So if you're doing that, why not just for this time, just for this kind of short-lived time in your life, it would most oftentimes be recommended to push back a little bit.
And one more question regarding this. If you're running and you're a runner, because I've had a ton of people that are trying to get pregnant while they're running, what is an abnormal amount of time that it should take somebody to get pregnant? Should it, like, at what point? I mean, I know if you're running a lot, at what point should you pull back?
Yeah. So for someone who is less than 35 years old, a normal amount of time to take to get pregnant would be a year, 12 months.
Okay.
After that age, so when you're considered an advanced maternal age after 35 years old, 6 months is the amount of time that we would recommend waiting. I shouldn't say it's abnormal to say get pregnant at 7 or 8 months, but it's an appropriate amount of time to have tried and to then offer or consider seeing a reproductive specialist, because as you get older, your egg quality starts going down. And so the sooner we can get you pregnant, the more beneficial long term. So it's more of a kind of you're more racing a little bit against time and the quality of of your fertility, or I should say in your fertility window. So
And Lilia, how can I be a better coach to people that are pregnant and trying to get pregnant? Like, what can I do to help them through this stage of life? I always like to hear more if I can.
yeah, I mean, I think you're amazing, so I don't think you can do much more. I know you personally, I know you're an awesome coach. I'm waiting to have you coach me. I said after I had all my kids, I said I was going to have you coach me and do Boston one day. That's still a goal one day, but not yet, Maria. Don't get excited.
Not in this. I was excited, but I know we still have a few more seasons till that. But you could definitely do that.
But to answer your question, I think all the things that you responded back to what we talked about is just normalizing the fact that they have the expectations, setting the expectations that they're not going to be at their prime PR levels. They're not going to be set. I mean, maybe they'll set PRs, but likely not. And not to challenge their bodies too much. That's not the goal. And realistically, I think it's great what you said, 30 minutes or less than 30. I think it's great just to maintain their heart health and just the benefits that they're gaining from that exercise on the pregnancy and on their long-term health is tremendous. So yeah, I don't know that anything. I'd be interested to see how you coach pregnant women. Just to,
we could go to lunch and talk about it sometime.
Yeah.
And then also, how do you coach? And then how would you advise for those months afterwards? I mean, you're physically tired, but mentally exhausted, but also your body is still going through all of those changes. So when can they expect to be back feeling quote unquote normal?
Yeah, so at the postpartum visit, I always see all of our patients at about 2 weeks for just a follow-up, a check-in visit, and then again at a 6-week visit. These are just such arbitrary numbers or timeframes to follow up with patients after they've had this huge change to their body, to their life, huge milestone in their life. But so when we see them, usually by the 6-week visit, we say that at that point it's been a substantial enough amount of time that you can start resuming activity as you've been doing, before the delivery. And so, depending on the patient, what that may look like, that may be just, walking for 5 minutes out, taking a walk. Or that may mean like going out for like a 15, 20-minute run. And I always say like, do 5 minutes less than what you were doing just before pregnancy, at least for a couple weeks, like 1 or 2 weeks, start out, and I say, start back at 1 day a week. Okay. For maybe just like a week, then go up to maybe 2. If you're feeling really good, fine, do every other day. It really just depends on the patient and how active they were before the delivery. In general, it would take about 12 months for your body to recover to the point that we say like your body is recovered enough, it's at a good baseline to where you're good to try and have another baby. So I kind of go by that, physiologically, your organs take at least that much time to support a very healthy subsequent pregnancy. And so from that standpoint, I think that gives them a good perspective of like, okay, my body needs time to heal. I can get that. And so as long as they're feeling comfortable, they can keep doing whatever exercise. And there's not really any hard stops if they're feeling good, if there's not any kind of, if they're not having any complications, obviously. But in the general sense, like think of it as your body, you're not going to be back at, running how you were before this pregnancy, right away. It's going to give yourself a year.
Yeah. And I see a lot of women will come to me at their 6-week appointment, after their 6-week appointment, and say, the doctor said I could go. And then they're breastfeeding. And I'm like, okay, guys, like they're breastfeeding and then they're trying to lose weight while they're breastfeeding, which makes me a crazy person. Cause I'm like, okay, now we're breastfeeding. We're trying to feed a baby and we're trying to lose weight and we're trying to run at the same time, which is very hard on your body. So I would say if you're going to do that and you're going to run, make sure you're eating enough, because breastfeeding takes a tremendous amount of calories, more so than when you're pregnant.
Yes.
So you got to make sure you're eating enough to support the activity that you're going to do as a runner. You can't just go back in and think, I'm just going to get back to my pre-pregnancy weight in 12 weeks, or it's going to be tough on your body.
I can imagine people asking me that question.
All the time.
Like right away. Like I know as a runner, it's like, all right, can I get back to what I'm doing? But I would say that's another good point. Definitely. I hit on that. Absolutely. I say, if they're breastfeeding, that's at least another 300 calories a day that your body requires. Hydration. So when you're breastfeeding, and then on top of that, now you're losing obviously fluids from running, you need to support that for sure, especially with breastfeeding. So definitely being very mindful of hydrating well. Don't and some people do this. I have some patients who, are runners, and they'll be like, oh yeah, I just went for a run, then I breastfed my kid. I'm like, gosh, that is so taxing on your body. Make sure you're drinking lots of water in between. Like and if you're a good producer, breast milk producer, it may not affect you, but some who then struggle with production problems, and they're going out and exercising, and now they're low on fluids, you can definitely put yourself in a place where it's not ideal for your body. You're not supporting your body to really to support you.
Yeah. And women already struggle to eat enough anyway. So we got to be extra careful about that.
I do find as women are trying to get pregnant and in a pregnancy, finding a doctor who or nurse practitioner like yourself, or a midwife like yourself, who had been through the same things, is a runner, can give you actually more anecdotal, like, this is how it's going to feel, because I do feel like, reading from a book versus I've been out there running and it's tough would be advantageous to be able to know what they're going through.
Absolutely. Yes, absolutely. It's, I definitely, as soon as a patient tells me like, I've been running and I know you're going to tell me to stop running, and I know I'm not supposed to be, I'm like, no, hold on. Like,
Wait.
I promise, like, I'm on your side. This is all great. And then they kind of, I've had patients where they're like, they kind of take they give me like a sigh of relief, like, oh, okay, like, yes, I can keep running. But I said nothing. I'm like, always like, just don't make it extreme. Just let's have a good balance. It's going to support your pregnancy. You're going to be happy. You're going to be healthier long-term, and you're going to be at a good point afterwards to really help. And to have a routine for yourself. We touched on, like, physically it's good, mentally it's good, but also for after you have a baby, say this is your first baby, it gives you your own routine back. It gives you a piece of kind of your own of you back, when everything else is not your own. Like it's all on the baby's time, and so when you come back, you can have a little piece to yourself to keep hitting and to keep having like a goal for yourself.
Yeah, that's such an important part of being a new mom, because sometimes we feel lost and we're like, oh, we're just all about the baby and we're just a milk factory. And it just
Yep.
feels like when you have that, I had bought this, I've written many articles about this, but I literally bought like the nicest baby jogger, because I was like, I'm gonna take my baby out in the baby jogger. And I did it one time and I was like, hell no, I'm not doing this anymore. I want my me time back. And so then I would just get up early. That's how I became an early runner. And I would leave the baby with dad and before he went to work and go for a run. And it does make all the difference in the world in your mental game, I think.
Having a little
Totally.
piece of you that's
Yes.
still there, and we'll get more and more bright as the child grows. Lily, I don't know if you've listened before, but we do a segment here called Coach's Drill, because you've known Maria for a while and she has a lot of thoughts on things, and so we give her 1 minute, we time it, and she can say whatever she wants. So today's Coach's Drill: less is better than none.
Yes, here we go with one of my favorites, because we always think we have to be perfect in every single thing that we do and that more is better. And if I don't run 40 miles a week, I'm not a real runner. And I'm here to tell you that is not true. Less is better than not doing any. In fact, this morning while I was out on my run, and we are on a little bit of a family vacation, I ran 35 minutes instead of my normal 45 because I just didn't feel like it. And guess what? I'm still a runner, guys. So same thing when it comes to pregnancy. You're still a runner, even if you walk 10 to 20 minutes every other day. You're still a runner. If you go out there, even if you have to walk for your pregnancy, you're still a runner. If you started running before pregnancy and you have to stop a little bit, just get out there and do what you can, and you'll still be a runner, I promise.
All right, in less than a minute. So
Less than a minute.
and because I mean, I think that's what I definitely heard Lilia say, like setting those expectations. Don't expect to be a 40-mile a week runner through this very important time where you are growing a human. It takes a lot of effort and a lot of work on your body.
You
Yeah.
see also on the news, randomly you'll see like these runners who are like 40 weeks pregnant doing half marathons. And my mind is blown. I'm like, more power to you. I'm always thinking like, how are you nourishing your body for this? Like, what have you done to prepare for this? Like, wow, your body's really doing a number there. Like, I'm always blown away. My mind's always blown. And that's not, you don't see that often for a reason. It's not normal. It's not it's not the usual.
Yeah, there was a lady at the Olympic trials in Orlando, and she was only going to do like a couple miles. And I think, how many miles do you remember that she did, Maria?
I think she did 16
it was
actually.
significant. And
Just 16.
But and it was hot that day, but she actually, and she did well listening to her body. She just said, you know what, I feel okay, so I'm just going to go with what I can do. I think and if you feel great and you feel like your body can handle that, and your body will tell you, and a lot of these people that are like professional athletes, they have cooks and massage therapists and people that are preparing, and we don't have that. So we have to be a little bit more careful. But I find for most of my runners, and I'm sure Lilia sees this a lot, you kind of have to be really specific with runners, because even if you're just coming out of surgery, my doctor would say, just be reasonable. Well, reasonable to us is a little different than what's reasonable to other people. Like, reasonable to me would be a 40-mile week when I'm running 60 miles normally, or a 30-mile week when I'm running 50 usually. And that still cannot be reasonable if you're pregnant. So I would just say when you go to your doctors, ask specifically, like, what do you think would be best for me? Don't just assume that your reasonable is reasonable, because it may not be.
That's a good point. I should have mentioned that too. I will ask them for like a diary of what their typical week is like,
nice.
activity level wise. If you come to me, like if you're concerned about exercise or doing too much or too little or whatnot in pregnancy, that's my first question. It's like, what have you been doing? You're right. being specific is it. It
With
definitely,
runners, we need
it definitely
specificity.
is important. Yeah. So like, can I do the 30? Oh, you're saying like, oh, so it's just 28 minutes? No, like I'm like,
Yeah.
no, let's just talk specific. What have you been doing?
Reasonable to us is very different. So
Is there
I know.
anything, Lilia, that you want, you sort of want to blanketly tell either the pregnant woman who's listening today, their family, the person who's trying to get pregnant, the person who's just had a baby? Is there something that you just always want to leave someone with?
I think the biggest thing in all pregnancies, not just running specific, that I like to drill is that stop looking at everyone else who's pregnant around you and thinking that that should be your criteria to meet or your baseline or where you should be. Just kind of focus on yourself and really try to tailor your daily, your everyday, life to yourself. So whatever that may be, whatever makes you feel good. And so same with exercise. You shouldn't compare yourself to someone else. Oh, I had a friend who continued to run into her third trimester and she was so fast. And don't do that to yourself. Just do and definitely consult with your provider through your pregnancy. It's very important. Consult with your coach and make sure you're doing whatever feels good physically, but also giving yourself that mental break and being able to go out and do the activities that you did pre-pregnancy too.
And don't do that when you're not a pregnant runner either.
Yeah.
No comparing.
Right. No, don't
Yeah.
compare. Well, because I mean, both of you have just said every one of your pregnancies was different. So it's not like,
Yeah.
especially in your first one, you're looking at someone else like, why is mine different than this? And it's like once you get to the second and that Lilia for your third one, it's like, oh, every pregnancy is different, even the same
Yeah.
person.
Yeah, and
That-
I've seen
that
people
right
beat
there.
themselves up. I've seen people beat themselves up for like having placenta previa or having something, and they're like, "Well, how come my pregnancy was bad and hers wasn't?" And I must be a bad mom because of that. I cannot tell you how many times I've heard that, which is just so silly.
Sad.
Like we
Yeah.
all have different bodies, and we all can handle things differently, and we just don't compare. It's just not going to help anything in the process, and it makes you less grateful.
Exactly what Lee also just said was each pregnancy is so different. I say like the same person can have a different experience through each pregnancy in all ways. And that affects, I mean, activity level wise too, same. Don't compare to others, but don't compare within your body how you were 5 years ago with your first pregnancy. And then now, 2 years, let's say 2 pregnancies later or next pregnancy. Don't compare yourself either to yourself prior to your now.
Yeah. And
Also, if people are fearing coming back after pregnancy, I've had more women come back and crush things that they couldn't crush before just because of their mental game after pregnancy. Going through pregnancy is mentally challenging and it takes you to another level. So don't fear like your life is over because you're pregnant or after pregnancy. It might take you a little longer, but you can come back stronger, I promise.
It truly makes you stronger, that's for sure. And isn't like the 40s age group, isn't that the most competitive age
Yeah,
group in
for
all
women
races?
it is. For
Yeah.
women,
And
yeah.
I strongly believe that's a pregnancy related positive.
Yeah.
there you go.
Like that definitely is due to having part of it. There's other, obviously that have not had kids who are amazing runners in their 40s, but I think that contributes.
Absolutely.
All right. Well, thank you, Lilia. Thank you for giving it your time, and
Yeah,
Maria,
thank you,
and for
Lilia.
breaking
Thank
away
you.
from your family. I think this is so important. Every one of my friends who've gone through their pregnancy and exercise always ask me questions, and I don't have the answers to. So I'm just going to point them to this podcast, let them listen to the experts there.
Thank you so much, Lilia.
Thanks, y'all.
Thanks, y'all.
Good to see you.
See you
Keep
next
out there.
time.
Bye.